Hey guys, I'm back with another answer to a question that someone wanted to know. Should I take calcium dairy with kidney stones? Okay, very good question. Some studies show that consuming dairy will help you reduce the kidney stone because when you consume it, it goes through the digestive system and it binds with calcium in your digestive tract, and there's less binding going on in the kidney through the blood. Here's the problem. A lot of people have milk allergies to the protein in the milk. Casein, even sometimes whey, those are two proteins. And a lot of people are sensitive to lactose, the sugar in milk. Not to mention, if you consume milk products from cows consuming grains, not to mention even if it was organic, it's still non-GMO or still without pesticides, but those cows are still consuming grains, you're going to have higher amounts of omega-6 fatty acids compared to omega-3, increasing the inflammation. So if you think about this, you have this oxalate crystal stone, okay? It's in your kidney, and it's not smooth, it's jagged, it's irritated. This is why a lot of people actually bleed when they have a kidney stone, because there's these sharp edges that are literally tearing the inside of the kidney up, especially if you're jogging. And then that damage to the filtration unit of the kidney starts developing scar tissue. So now we have a loss of function of the kidney. So if we're going to add more inflammation to the kidney, that would be bad. We want to reduce the inflammation in areas of your body that are damaged. Now, if you were to do butter, or better yet, ghee, which is basically just the fat without any of the protein, this would not be a problem, especially if it's grass-fed. And also, I think whole cream is going to be fine too, because there's going to be less casein and less things to be allergic to, and definitely less lactose. So we're just dealing with fat. Now, I've done a lot of other videos on this where I talked about the foods to avoid spinach, beet tops, even though that I'm recommending that in other videos because of the potassium content. If you're predisposed to getting kidney stone, you want to avoid beet tops and peanuts, other nuts as well, tea, chocolate, avocado. I mean, think about when you do keto, these are the top foods that you would eat. So you may have to just switch those foods if you have a tendency to get a stone. And I think it's important to consume foods high in calcium, but not dairy unless you are sure you don't have an allergy. And if you're going to only focus on grass-fed, I think that would be fine. All right, these are the foods that are high in calcium. We have seeds, we have sardines, fish, seafood, and dark greens. So these are going to give you your calcium, which will help bind the oxalates in the digestive system, so there will be less binding in the kidney itself. So the goal is to decrease the development and formation of oxalate crystals, okay? One of the best antidotes for that are citrates, okay? Citrate helps decrease the formation of the crystals and decreases calcium saturation. But you can do various forms of citrates. You can do potassium citrate, magnesium citrate, you can even do calcium citrate. And a lot of you may already have my electrolyte powder, and you may not even know this, but all of the minerals are in a citrate form. Calcium citrate, magnesium citrate, potassium citrate. So that can actually help decrease the risk of the formation of an oxalate stone. Foods high in magnesium, that's all the dark leafy greens. And this is a really good remedy, hydroxycitrate, okay? This is a really, really important one, especially if you had a stone and you want to prevent another stone, okay? This will help dissolve it. And lastly, a lot of lemon juice, okay? I mean, when you do the ketogenic diet and you're drinking fluids, it's important to add lemon at least every day to that water. It doesn't even have to be fresh lemon. It can be in a jar. It's already pasteurized because you're just getting the citrates from that, which will actually decrease the formation of oxalate stones. Now, if you actually happen to have a stone and it's trying to pass, or it's irritating you and you have a cramp in your on your right side, I'm going to recommend, if you don't have this, start drinking a lot of lemon juice, okay? Or a lot of citrates, whether potassium citrate or magnesium citrate. If you consume a lot, you can down a lot of this and drink a lot of water. That will help to flush that out and decrease the severity of the pain. All right, thanks for watching. So if you want more knowledge on how to create a healthy body, subscribe now and get daily notifications. Daily notifications, that sounds weird. Well, I'll just remind you on a daily basis. How about that?